Hello, good evening. How are you doing? My name is Afe. I'm an FNP student. I'll be doing an abdominal assessment on you today. What is your name? What's your date of birth? I'm just gonna wash my hands. All right. So, basically, I need to get your consent before we start the video. The video that we're doing today is going to be recorded, posted on YouTube, and going to be submitted to a teacher for grading. Is that okay? You have my consent that we're doing this today. Can I have your consent on that? Oh, for sure. Thank you so much. Okay, so we'll go ahead and start with the abdominal assessment. Before we begin, I would like you to get in a comfortable position as you lay down. Alrighty. All right, just make sure you feel as comfortable as possible. If you'd like, I can put a pillow under your leg here. Okay. All right. So what I want you to do is just have your arms to the side. All right. Your knees slightly flexed. All right. That's perfectly okay. No, no, just as much as you feel comfortable with. Your knees are slightly flexed. That's good. All right. You feel comfortable? All right. Sure. All right. All right. You're welcome. Okay, so we're going to be conducting an abdominal assessment on you today. What we're going to start with is we're going to go with this looking. All right, we're going to listen, and then we're going to feel. We're going to feel by percussion and palpation. Okay. All right, so I'm going to open your stomach now, and we're going to do a little bit of an assessment. All right. So with your abdominal assessment, when I'm looking at your abdomen here, I'm looking for any rashes and scars that might be indicative of a past surgery. I'm also looking for any unusual inflammation. And I'm also looking for normal peristalsis or any kind of movement of your GI tract. And just let me know, what's going on there if you're having some hypoactive movement. I don't know any unusual skin color. A yellowish skin color will be indicative of possible diagnosis of jaundice. Right? You don't have any skin discolorations. Your abdomen looks symmetrical, no unusual outgrowths. There might be an indication of a hernia. All right, when I look at your abdomen, everything looks as it should, normal. If you had any past surgeries in the past with your abdominal area, no. All right. Okay. If you had like any issues with you having normal bowel movements, no. Okay. All right. So everything looks fine so far. All right. So we look now. We're going to go into the portion where we listen to your abdomen. Is that okay if I use my stethoscope to listen to your abdomen? Yes. All right. So we can listen to all four quadrants. All right. And I'll be using my stethoscope for that. Okay. So I was listening for balance sounds, any tinkling or gargling in your stomach. I'm looking for balance sounds to be present about 5 to 15 every 60 seconds, and everything sounded normal. There was normal bowel activity, tingling, and gargling sounds. No hyperactive bowel sounds. No unusual uh, movement of fluids within your GI tract. So that's good. Now I'm also going to listen to your larger organs there, all right, like your liver and your spleen. Just listen for tympani. All right. Okay. Take a deep breath for me. and out. Thank you. Thank you. Okay. No dullness noted. All right. So, and no unusual movement of fluids around your in those areas. And now I am going to go ahead and listen to your the arteries that perfuse your GI tract. So we have the renal arteries, we have the iliac arteries, and the femoral arteries. I'm going to listen to them now. Right. I'm also going to listen to your aorta. Right. Okay. I want your aorta. I'm going to listen to that with the bell and the diaphragm of my stethoscope. Okay. No buoy noted in your the descending vena cava in your as it runs down to perfuse your lower extremities. Now I'm going to listen to the renal, iliac, and femoral arteries. Listening for buoy or unusual sounds. Uh, I'm just going to verbalize it. I'm pulling down your hands here for the. Okay. Mm. All right. No bruise noted. Your renal, iliac, and femoral arteries seem to be perfusing well. There's no issues. All right. Now I'm just gonna one more time listen to your larger organs. All right. Splenic area. Okay. And now we listen. Everything sounds within normal limits. I am now going to go ahead and percuss. All right. Percussion. I'm just gonna place my finger on your stomach and just tap lightly. All right. Is that okay? Yes. All right. I'm gonna percuss your abdominal area first. I'm listening to your intestines, and then I'm going to percuss your larger organs. All right. Listening to any dullness or tympany. All right. You ready? Mhm. All right. Tympany is noted in all four quadrants, as is expected, because your GI tract is filled with air. All right. Now I'm going to listen. Take a deep breath and breathe out. Okay. Deep breath in and out. Okay. Your liver sounds as it should, normal. Now I'm going to start hearing a little bit of dullness. That's marking the border. You breathing for me? Okay. A little bit of dullness there. So that's the lower border of your intestine. We're going to start from the top here. All right, and just tap. Okay. All right. All right. And I'm just going in between your ribs there. All right. So your intestine sounds normal, and there's no unusual tympany there. And with your liver, it spans about 4 to 7 centimeters, which is fine. And then its length 6 to 12. And I'm going to listen to your spleen now. You're breathing for me and out, please. Thank you. Again. Okay. Uh, no unusual, uh, no unusual dullness or enlargement noted. If I had any enlargement, uh, you know, or dullness when I tapped your spleen, it would be indicative of a splenomegaly or inflammation of your spleen, and that was not noted. Okay. Do you have any questions for me so far? No questions. Okay, so now I'm just going to go ahead and do some light palpation there of your intestine. I'm going to start with the light palpation. Okay. All right. Same way through all four quadrants. All right. All right. No unusual dullness noted. All right. Now I'm going to go into some more firmer palpations. Okay. All right. Okay, so I'm going to start with your GI, listening to your, looking for palpations, unusual masses, as I was, and for unusual masses in your intestine or any unusual dullness that might be a sign of constipation. You might have like some fecal impaction. So I'm just going to go ahead and palpate deeply. You feel any pain there? Okay. Any pain or discomfort? Any pain or discomfort? All right. Any pain or discomfort? All right. Now I'm just gonna palpate your large organs there, starting with your liver. And I do note normal pressure there. Now I shouldn't be able to palpate or feel any of your organs as I do that. That'll be a sign of organ enlargement, which is what we don't want. You understand that? Yes. Thank you. So no unusual feeling of an organ enlargement noted. Okay. All right. No issues there. All right. So we finished with our palpation. We note that the organs are within the normal size, no usual enlargement. Now we're going to go into some tests. All right. So I'm going to start with the fluid shift test. What I'm going to do is I'm going to put my hand here and I'm going to tap on one side of your stomach and I'm going to note for any fluid shift. Is that okay if I do that? Is that okay? All right. So I'm going to put my hand right here. I'm going to tap. No unusual fluid shifts. So any fluid shifts will be indicative of possible ascites, and that is not noted within your abdominal area. So that's a good thing. All right, now we're going to go into the next test is going to be the McBurney's test. Okay. So in the McBurney's test, I'm going to look at your umbilicus and the top portion of your right hip. All right. All right. I'm going to go 1/3 of the ways down, and I'm going to press down. All right. When I press down, uh, when I release my hand with this McBurney's test, if you feel any unusual pain, please let me know. Is that okay? Yes. All right. I'm pressing down. You feel any pain? All right. Take a deep breath. I'm pressing down. Any pain? Okay, good. So the McBurney's test is negative, and if it was a positive test, that would be an indication of possible appendicitis. Now I'm going to do uh, another test here called the Murphy's test. Now, I just palpated your right lower quadrant, and I'm going to go to your right quadrant. All right. I'm going to press down. I'm going to press down. All right. When I press down on your right lower quadrant, your right upper quadrant of your stomach. All right, press down. If you feel any pain when you take a deep breath and causes you to stop taking in a deep breath because of the pain, please let me know, okay? I'm gonna press down until you take a deep breath. You ready? Are you ready? All right. Pressing down. Take a deep breath. Breathe out. Okay? You feel any pain? Okay, once again, pressing down. Deep breath. Out. Okay. Well, there's no indication there that you have any issues with cholecystitis. You want to know what cholecystitis is? Yes. And that's an inflammation of the gallbladder. Oh, not the colon. Yeah. Oh. All right. Do you have any other questions for me? No, that was it. All right. Well, thank you for letting me do this abdominal examination with you today. And please have a good evening. You right? Too. Try to get some rest. Blanket? For sure, I can do that. All right. Have a good evening. You too. All right. Thank you.